Hi, it's Erik Paulsen, and welcome to our video conversation this week. We all know it's back to school time. It's also back to school for those of us who are in Congress. In Minnesota, I've had a chance to visit 197 classrooms, and I'm looking forward to the opportunity to visit some more classrooms as the new school year has begun. In Washington, we've begun debating the Iran deal, which is going to take up a lot of time and attention for the next several days as well. Now we're going to get to our questions, and the first actually comes from Kathleen in Eden Prairie, who wrote in by email. She says, "Dear Congressman Paulsen, last week my daughter had the honor of visiting with your staff in Washington regarding proposed changes to coverage for prosthetics by Medicare. Please take note of the seriousness of this issue. It appears that Medicare wants to implement changes which will set back all of the progress in prosthetics which have been made in the past 10 years or more. Please encourage the right people to make common sense decisions. Thank you, Kathleen." Kathleen, as you point out, the loss of a limb can be a very traumatic experience, and thankfully medical technology today can offer the opportunity for those individuals to live a much healthier lifestyle. Unfortunately, we have the government agency that oversees Medicare is proposing significant changes in the rules that would limit the ability for individuals to get advanced prosthetics with this new medical innovation, new medical technology. That's wrong. I've sent a bipartisan letter with some other members of Congress to the agency asking them and pointing out to them they need to reverse direction on this policy. Next up is an email from Kelly in Wayzata, who writes in, "Representative Paulsen, the abuse of prescription painkillers is having a devastating effect on public health and safety in communities across the United States. According to the Centers for Disease Control and Prevention, drug overdoses now surpass automobile accidents as the leading cause of injury-related death for Americans between the ages of 25 and 64. We must do more to get this problem under control. Thanks for your attention. Sincerely, Kelly." Actually, Kelly, as you point out, this is a very important issue. We've seen a dramatic rise in the number of individuals who have used non-prescription or prescription-based drugs that are abusing those types of drugs. In fact, they say that now about 52 million Americans that are above age 12 have used a prescription drug not for the prescription purpose. It is an epidemic that is causing a lot more challenges. The good news is, this week overwhelmingly, Congress passed a new tool that will allow electronic medical record keeping, so we have another tool to track and better make available information about where these drugs are going, who's prescribing them, etc., so we can actually move forward on some other common sense policy directives to address the opiate abuse problem. I want to thank everyone that have shared their thoughts, their ideas, their questions. Feel free to reach out anytime on Facebook, on Twitter, or of course now on Instagram at paulsen.house.gov. Have a great weekend.